I am doing a basic video on our NeoT. So the NeoTs are super simple to set up. It comes like this. There does not come with a mask, although generally we do keep a mask in the bag with it. It is generally going to be our larger size mask. And getting it set up, you just plug it here into the little male end on the warmer. It should already be set to 10 liters. If somebody's come around and messed with this, just make sure you set it to 10 liters. Turn it on. From here, we will set our pressures in 20/5 as our starting pressure. So you can see we are not getting 20. So this can be a little confusing. You control your peak inspiratory pressure with your big valve. And you can see here, this little one right here says PEEP. So you control your PEEP here, and again, your peak inspiratory pressure here. So imagine you're giving a breath, you can see I'm only getting a pressure of 5. So using this larger dial, I will slowly dial up until I hit 20. So now whenever I give a breath, I'm getting that peak inspiratory pressure of 20. But you can see I'm getting no PEEP right now. So that's what this adjustment's for. You just slowly turn, and you can see it slowly starting to rise. And there we go. So now we have a 20/5. When you are setting your pressures, you do want to use this little red cap. This red cap creates a full seal. So, if you use your hand, so you can see using my hand, it can be a little less accurate. So it's generally recommended seal it with your red cap when you are setting your pressures. Again, generally on the warmers, we are going to keep a few different sizes of masks. We are using the large one is generally what we're keeping in the bag. We do have a smaller one, and we actually have this really, really tiny one for the super preemies. You can see this is a small mask. These can be used with ram cannulas. One thing you want to know about ram cannulas is it attaches here and not here. There have been people who have tried to pull this part off and attach it here. Again, you want to use it here because this is where your pressure monitoring device is at. If you take this out of line and connect here, you no longer have any idea what pressures you're giving to the baby. So if you use a ram cannula, it's always got to be after your pressure gauge. So once you've got your pressure set and you're giving breaths to baby, again, these are very simple devices to use. You're putting the mask on, and it's just breath, 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 breath. So you can see it's not fatiguing like using a bag mask. You can just give these simple breaths. Now, if something's not working, it feels like your breaths aren't working, you do need to remember your Mr. SOPA. So your breaths aren't working, I'm not seeing any chest rise, baby sats aren't coming up, heart rate's still down. So again, remember your Mr. SOPA. Adjust mask, none of us are used to working with these little preemies. So you make sure you got a good seal on your mask. Make sure you're not occluding the lower, not soft palate. Make sure that you're not pressing on the soft tissue under the lower jaw. That is a common problem. People press on that soft tissue and they close off the airway. So be aware of that. So be mindful of where your fingers are. Adjust your mask. Adjust to a bigger or smaller mask if needed. If that's not working, the R, Mr. SOPA, your R is reposition head and airway. Again, sometimes with those babies, what I see is when people are pushing the mask down, they are pushing it in a way that kind of tilts the head down and in, and the jaw slides back, and again, that pushes that airway and just kind of closes your airway. So again, make sure that head's back, sniffing position. One of the things we like to do is we like to take a washcloth, roll it up, put it under the shoulders, and that just kind of naturally brings the head into that sniffing position. Still not working, what do we do? Mr. SOPA, again, I'm going to say it every time, suction the mouth and nose. That's another common problem. Babies can get real junky back in there. give the mouth a quick suction, give the nose a quick suction, try again. Still not working. The O is open mouth and tilt jaw forward. So you kind of got to imagine that, what is that called? The jaw thrust. You kind of do that with the baby. Again, open the mouth, make sure you're not pushing the mouth shut, you're not pushing the jaw back. Still not working, that is a case where we can start increasing our peak inspiratory pressure, which again, we do with our big dial here. So generally, 20, you bump up to 25. I would keep your provider in the loop and let them know that's what you think you should do. They will probably tell you that's a good idea if you are at that point in the Mr. SOPA. So increase to 20 to 5. If rescue breathing is still ineffective, it is time to consider an artificial airway, that CA of Mr. SOPA. You can use an LMA if you have one on hand. If you don't have one on hand or do not feel comfortable, then it's time for an ET2.